we now know that achieving and also sustaining open defecation-free status does not lead to the ultimate impact on the public health perspective. That's why we need to emphasize how that safely managed sanitation services are critical.
And if we really want to achieve this SDG target of universal access to sanitation by 2030, that's in just 6 years' time, we will need to accelerate the rate of progress by about 5 times the current rate of progress. And this acceleration is needed even more in the least developed countries, where we need an acceleration of 16 times the current rate of progress to meet the SDGs.
We all know that sanitation is a public good. So because it is a public good, the government should be able to take lead. What we have seen in the developing countries is that the government sometimes takes the backseat and leaves the development partners to take lead in delivery of sanitation and hygiene services to the population.
Urban settings have many captains, and urban sanitation often doesn't have any specific owner. So there may be a municipality, and that municipality has a department which is responsible for cleaning and for solid waste. And there may be a utility which is mostly focused on water supply. And then there may be a planning agency which is mostly focused on planning but not so much on management later on. So that makes it challenging to see also where does sanitation now fit in institutionally in that context.
Lack of harmonized approaches. They lack coordination, disjointed efforts between many different actors, not addressing the needs of entire populations, and so people are left behind.
Sanitation is a system-based. We've heard so many times how important the systems is, and also outcome-driven framework. Not necessarily a tool or approaches as such, but it is a framework which is important to achieve equitable, universal access and the use of safely managed sanitation in a given administrative area.
So how do we achieve service delivery at scale in practice, and what principles can we keep in mind in order to truly achieve scale? First, we have to move away from standalone, isolated, project-based approaches that haven't always managed to achieve results at scale to more comprehensive programming. And when we talk about comprehensive programming, it's really thinking about having the key elements in place of having the hardware in place or the services, as well as the behavior change approaches or demand creation, and also obviously strengthening local systems so that we have a good enabling environment for all of these changes.
We have developed a city-wide inclusive sanitation action plan to ensure municipality is accountable, responsible and capable to do adequate resource planning.
That situation analysis around the system is critical, so that we understand and identify the unique and context-specific strengths and the gaps.
Sometimes cities and national governments get stalled because they look at the cities and they calculate the amount of investment which is needed for infrastructure, and they sort of say, this is not possible, let's wait for somebody. But there's already a lot that can be done by regulating better and organizing better what is there.